for people with developmental disabilities with the ones in the boxes below. So the day support waiver will become the building independence waiver. The DD waiver will become the family and individual supports waiver, and the IV waiver will become the community living waiver. Anybody who is currently in the waivers in the arrows will just transition seamlessly into the waiver below it in the box. There will be a few children who are currently in the building independence, or I'm sorry, currently in the day support waiver, who will no longer be eligible for the building independence waiver. So that's just for adults, and we will move those children to the family individual supports waiver. But other than that, people will just transition to the successor waiver.
Excuse me, Dawn.
Yes.
Would it be possible to move any closer to the microphone? We're getting it. Sometimes it's clear and sometimes it's not. Thank you.
Okay, I'll do my very best here. Okay, service planning process is our first real topic here. This slide shows the building blocks of the DD system, and basically just is a pictorial representation of the services that are included in the amended waivers in a variety of different categories. So we will have some of the same existing services in the amended waivers, as well as a variety of new services in these various categories. I do want to give a caveat that although we have submitted the amendments to CMS, we have not yet received CMS final approval on any of the amendments. So the information that I present here today is subsequent to change by CMS. Person-centered plan. So the DVHDS developed a person-centered plan format a number of years ago, and that has been modified and enhanced over the years as a result of experience and stakeholder input. It has 5 different parts to it, and the website listed at the bottom of this slide is where you can get a lot more information about the details of those parts. We've used this person-centered plan format for the ID and the day support waivers for all those years, and we are planning on phasing in the use of that with each person's annual plan for those who are currently in the DD waiver, moving into the family individual supports waiver. So there will eventually be a unified plan format for all individuals in DD waivers. The supports intensity scale has also been used for planning purposes since 2009. So it's been used in tandem with our person-centered plan, and we found the supports intensity scale to be very helpful to assess the individual, to document the agreed upon outcomes, and showing how people achieve those outcomes over time, and also as a way to document what's important to the person as well as what's important for the person. The SIF will also be used for individuals in the current DD waiver morphing into the family individual supports waiver. We're in the process of ensuring that all individuals have a updated, valid supports intensity scale. And again, our website has a great deal of information about the supports intensity scale, and that link will take you to all of that detailed information. Also related to service planning, some of you may have seen this particular slide in other presentations. This is our integrated support star, and it's just a way of conceptualizing support and service planning and acknowledging that a person's individual support plan can have any of these types of support for the person. People bring to the table their own personal strengths and assets, things that they're able to do by themselves, related to their own personal knowledge or education. They bring to the table relationships, family members, friends, religious community members who also can provide them with support. They have eligibility-specific support, so the types of paid support that are available through the waiver. other community support they may be participating in, such as school or parks and rec, utilizing transportation services, any of those sorts of things that are available to anybody in the community. And then technology types of support. So in the waivers, for example, this might currently be personal emergency response systems or assistive technology. It can just be things like a smartphone or an iPad that just help assist that person to manage their daily life. So this is our way of sort of representing all of that. And it is somewhat related to the new tool for service planning that we're going to be implementing with the amended waivers of a particular calendar format. Our contractor, HSRI, Human Services Research Institute, has been developing this calendar format for us and other states that they're working with so that the support coordinator, case manager, when meeting with the individual and the team on an annual basis, can sort of populate this calendar with the types of support that the person is receiving on a general basis. This isn't going to be as specific as the particular calendars that go along with a particular service, but this will give an overview of a person's week in terms of the types of support included on that integrated support star, how present they are in a person's life. So where are paid services in a person's life? Where are they having some time where they're demonstrating their own independence, being on their own? Where are they being supported by folks that they have natural relationships with, et cetera, et cetera. Right now, the green sort of paid time for a lot of individuals that we support may be a large quantity of their week. It would be nice to see over time that green decrease for some individuals for whom that is appropriate. And this will be a way to sort of measure and review that over time. All right, a little bit more about the role of the support intensity scale assessment. This is divided into a number of sections: support needs, protection and advocacy, and exceptional medical and behavioral. The support needs section actually is divided further into 6 life activity domains that are common to all people, not just people with disabilities. And those are listed on the slide. You should know that responses to certain questions in the exceptional medical and behavioral category may trigger the completion of another set of questions, the supplemental questions. And then certain responses to those supplemental questions may trigger a verification process. And that's something where DBHDS staff request further documentation from the individual's case manager in order to verify what level of support that person needs in some of those exceptional medical and behavioral arenas. The verification process never results in the assignment of a lower level of support for an individual, and I'll talk about those levels in just a minute, but it may result in the assignment of a higher level of support. So the results of the supplemental questions and the verification process do determine the person's level of support. We, as I said before, are requiring all individuals receiving services through the amended waivers to have a CIS, and our contractor Ascend is in the process of making sure that that occurs. They have been across the state, back and forth many times, and are continuing their work. As of the end of April, last month, 6,746 support intensity scale assessments have been completed by Ascend. And what we'd ask Ascend to do is to really prioritize those individuals who are participating in a type of service that has a reimbursement rate dependent on their level. And of those, we still have about 2,000 people that remain to be completed, and those should be completed by the end of August, according to Ascend's projection. So the top priority are defined as people who are in congregate residential support currently, other than sponsored residential, because that's phasing in terms of the levels and rate tiers in January of next year rather than earlier. Anybody who's on the day support waiver, anybody who's on the DD waiver receiving day support or currently pre-vocational services, and then those on the IV waiver who are receiving day support or currently pre-vocational services. So this shows the relationship of the level to reimbursement tiers. The SIS, as I mentioned before, and supplemental questions and occasionally the verification process will result in the assignment of an individual to one of 7 levels, and those 7 levels then are associated with 4 different reimbursement tiers. So you can see that the first 2 levels correspond to their own tier, essentially, Tier 1 or Tier 2. Levels 3 and 4 correspond to Tier 3, and levels 5, 6, and 7 correspond to Tier 4 reimbursement rates. A number of residential services, so group homes, sponsored residential, supported living, and independent living support, as well as some other services such as group day and community engagement, will be reimbursed according to these tiers. I should also mention that in addition to tiers, the rate structure of numerous other services reflects a higher reimbursement rate for more integrated services or smaller setting sizes. So group home also has that characteristic, where the smaller the home, the higher the reimbursement rate. And group supported employment is another example of that, where the size of the group predicts the reimbursement rate for each individual in that group rather than a tier. This slide just shows again how the tiers and the levels intersect, and it also provides information about the approximate percentage of individuals that we anticipate will be in the various levels, and then therefore the different tiers. You can see the majority of individuals are predicted to be in levels 2 and 4, which are sort of moderate support needs to high support needs. And then the other levels have lower representation. These percentages are based on 2014 HSRI SIS study. So this little graphic shows the progression where an individual is assessed using the supports intensity scale. The assessment then results in the assignment of a particular level from 1 to 7. The individual is going to be selecting his or her services and participating in those up to whatever limits are existing in the regulations. And the DBHDS pre-authorization staff will then ensure that the person's services being received match up with the various regulatory requirements and the individual's needs. Okay, support coordination and case management. Just very briefly about that. Many of you may be aware the CSE will be the single point of entry for the entire DD system, and individuals may choose to receive support coordination or case management from a CSE other than the one in whose jurisdiction they reside. And then those with a developmental disability other than ID may choose to receive support coordination case management from a private provider that has a contract with that CSE. And the Virginia Association of Community Services Boards has put together sort of a model contract. And I noticed that there have been a number of meetings in various regions between the CSBs of that region and the private case management agencies that are planning on supporting individuals in those regions. Okay, before I move on to new services, Maureen, do you want to go ahead and open up for any questions?
Sure, we do have a few questions. Dawn, could you tell us a little bit about who completes the calendar, how that's completed?
The calendar will be completed by the individual support coordinator or case manager along with the individual and members of his or her support team. But it's a responsibility of the support coordinator or case manager.
Thank you. And if a child is on the ID waiver waiting list, will they need to have a CIS performed?
Nobody on the waiting list is currently receiving supports intensity scale assessment. So they're just done once an individual has been assigned a slot.
And then, I guess along the same line, if children who are enrolled in the DD or ID waiver, they will need CIS?
Yes, yes. Now the CIS has two versions. The adult version is for those who are 16 and over. The child's version is for those who are 5 through 15. Anybody who is under 5, because the CIS doesn't have a normed version for those who are that young at this point, will be using another type of assessment for those individuals, some sort of a developmental assessment.
Dawn, if someone is there any chance for someone who is on the DD waiver to move to the ID waiver that is more appropriate based on their CIS? And I guess the same, is it appropriate for someone to move from ID to DD based on the CIS?
No, we're really not looking at the CIS as a determiner for moving between waivers, because individuals may be of any level, 1 through 7, on any of the 3 waivers. There may be other reasons why somebody would move between waivers more related to their particular needs for supports that are only available in a particular waiver, or because they can best be supported in a waiver other than the one that they're currently in, but it's not related to CIS or CIS scores.
When do you expect that the federal government, the Centers for Medicare and Medicaid Services, will approve the redesigned waivers, and will additional webinars be held after they're approved?
I can't guess when CMS will do that. I wish I did know, and I certainly hope that it's sooner rather than later, but I don't know at this point. We've received some questions from them, but my understanding at this point is that they are trying to review all of the waivers because they know that they're not really a package, but sort of a package, for us right now. And I believe that they'll be sending us a list of consolidated questions when they're done with that. So that's the best I can do in terms of predicting. And I'm sure that once the waivers are approved, and especially if there are any changes to whatever we've been presenting thus far, we will get the word out about that, however is possible.
Thank you. From the waiver network, in regards to waiver workshops, once their redesign is complete, and by complete, CMS has approved it, and we have emergency regulations, then we will be working on a PowerPoint presentation and materials for the waiver mentors to be doing community workshops. And we could certainly do that by webinar as well, of course. Where on the CIS document would a family find the level or tier that they've been assigned to?
They will not find that on the document itself, because that's not really a part of the official supports intensity scale. Now, the family or individual should receive a copy of something called the Family Friendly Report within about 2 weeks or so of the actual interview, supports intensity scale interview, and that will provide the actual results of the various components, the sections of the CIS. The level, it would have to wait a little while because of what I was saying about the verification process. Some may get kicked up to verification, and the level will be contingent upon that, but they will ultimately receive that sort of information through their case manager. DDHDS is actually in the process right now of assembling the levels and tiers for individuals for whom we have completed supports intensity scale assessments and have done those levels and tiers, and we'll be sending those off to the Community Services Board shortly.
Great. Yeah, we're getting a lot. We have 4 questions just on how do I get that information. So that's good, Dawn.
Yeah, that should be forthcoming pretty shortly.
In regards to another waiver that isn't the focus of our webinar today, the elderly or disabled with consumer direction waiver, the EDCD waiver, that offers adult day health care services. There's a question, will those adult day health care services be a part of the waiver redesign?
No, there's no plan to add adult day health care to any of the DD waivers.
And trying to keep the EDCD questions together a little bit, will children on the EDCD waiver have to have a SIS?
No, the EDCD waiver does not have the same requirements as these waivers.
Okay. And we have, will the calendar that you mentioned early in the webinar be replacing the general schedules that people use now?
No, it will not. The general schedule is actually much more specific than the calendar. The calendar, the purpose of that is to just show, you know, what portion of the person's life contains those paid supports, natural support, you know, as I said, independent time, those sorts of things, to ensure that the person is really having a life the way they want it to be laid out. The purpose of the sort of general schedules related to the various services are to show what types of service-specific support are being offered at what times of the day. So the calendar that I mentioned is much broader and would not include various outcomes or, you know, we just call them objectives as the specific service calendars or schedules do.
Mm-hmm. You've listed that technology is one of the integrated supports. And is this pertaining to how they use the technology that their families purchased, or will there be financial support to assist in the purchase of technology, assistive technology that people need? And is there a separate assistive technology waiver?
Wow, that's a lot of questions. So the star graphic just sort of shows the types of support, sort of the breadth of support that somebody might receive. And we are acknowledging that a lot of us, all of us these days, use technology as a support in our lives. There are a number of technological supports that are available through the waivers. We have long had the services in the ID and DD waivers of assistive technology and PERS. There's a new technologically based service that I'll mention in the second half of this called electronic home-based support. So those are all things that can be used to support an individual and would be represented in their overall plan. Now I know that DMS also has a technology-assisted waiver, but that isn't related to this in any way. That's a separate Medicaid waiver from the 3 that we're dealing with in today's discussion.
John, well, first, we're getting a lot of questions that appear to be from providers, and unless I can turn it into a question that relates directly to a person with a disability or family, I'm going to hold those questions and see if we have time at the end, since our focus really is people with disabilities and families today. But we will include those questions and answers from providers, or questions from providers, in our Q&A document afterwards. We have several questions that are coming in regarding case management, and one of them talks about that since the community services boards will be the single point of entry in the future for all developmental disability, intellectual disability waiver services. And those who have an ID diagnosis will have case management or support coordination limited to the community services boards and not contracted with private agencies. And then the question goes on from there. And some of the other questions are having similar statements. I think it would be best, rather than go through some of these individually, if you could give us a sense of when the new redesign begins, how individuals will be able to request services and what choices they will have within case management and within providers, not just case management providers, but service providers. Are you going to be getting, I think we're kind of getting to that right now, Dawn, so maybe rather than, do you want to answer that right now, or do you want to just wait till you begin the presentation again?
I can try to address that now, because it's not really related to something further on in the presentation. So once the waivers are approved by CMS, and I do want to again put in that caveat that, you know, some things that we have trained on or proposed in the amendments may not be what CMS approves ultimately. They have, you know, that right to question and require us to change things. So you know, that could include something related to this as well. But my understanding at this point is pretty much what is on slide 18, that once the waivers are approved, then the private first DD case management agency should be operating via a contractual relationship with the Community Services Board, and that individuals with non-ID developmental disability would be able to choose to receive case management from the CSB or from a private case management agency. That may be the agency that they're currently receiving services from, or another one. That choice is to be offered. And then, according to the document that VACSB has disseminated, those who are receiving waivers who have an intellectual disability will have choice from the CSB in whose jurisdiction they reside, or another one, perhaps a neighboring one, with whom that CSB has worked out some sort of a cooperative arrangement.
All right, Dawn, one more question, and then I think I'll go back to you, and then we'll continue with questions at another break. The last question in this section is, we have been holding off. We've been holding off on getting on the waiting list because we had an ethical issue with the IQ testing. Will we be able to now get onto the waiver waiting list without that testing?
So one of the things that DBHGS has been developing is some sort of a guided checklist for the CSBs who will be screening going forward all individuals with developmental disability. And that checklist, it includes the diagnostic information that is applicable to the new waivers, as well as giving some guidance on who is eligible to diagnose for different types of disabilities. So if somebody has an intellectual disability, that is typically determined through the use of a psychological evaluation, which is typically completed by a psychologist. Those who have developmental disability other than ID, those diagnoses may come through a variety of different sources. It may be a medical doctor who diagnoses the individual as having cerebral palsy or spina bifida, for example. And then there would need to be some documentation according to the state code definition of developmental disability that the person has deficits in at least 3 of the listed adaptive functioning areas. And that, again, might come from some other sort of a professional who is able to assess those through whatever means. So there will be that little guidance sheet that will help with that. But I would say that we would still need some sort of testing to verify a diagnosis of intellectual disability, just as we would need the appropriate type of assessment for determining that the person meets the different adaptive functioning areas.
But if they have adaptive functioning areas, then that IQ score is not relevant?
Well, I wouldn't say that exactly. It's really sort of a multi-pronged type of process. And I don't have the DD definition in front of me right at the moment, but it includes the adaptive, but then it also, includes sort of the other elements that need to be completed by somebody who is qualified to determine that particular individual type of developmental disability.
Okay. Maybe, and you can correct me if I'm wrong here, but an example could be an individual with autism. Right now, of course, there are many individuals with autism who do not have a diagnosis of ID, and they're using the DD waiver. In the future, that will kind of be irrelevant because you'll go to the appropriate waiver regardless of diagnosis, so long as you have the DD diagnosis. So that individual with autism won't necessarily have to go through a process of proving they do or don't have an intellectual disability, so long as they have all the other components of the definition met, definition of developmental disability.
Yes, that is true.
Okay, thank you, Dawn. Dawn, I'm going to go ahead and turn it back over to you to continue on.
Okay. So our next topic is new services. That these are in the proposed services in the amendments that are submitted to CMS. I'm going to start with employment and day services, and you'll see that those services that are listed in red are the new ones, and we just went ahead and included all of the various services in this category on there, and you can see which waivers the services are represented in. This particular slide has a little asterisk to indicate that any combination of the services on this slide cannot exceed 66 hours per week. So somebody may be receiving individual supported employment for 20 hours, maybe some community engagement for 15 hours, and community coaching for 5 hours a week, something like that. Would not exceed the 66 hour per week limit and would be acceptable. Okay, so related to the specific definitions here, community engagement is one of our new services, and its purpose is to really get people out in the community. It should be delivered solely in the community. It should have a ratio of no more than 1 staff person to 3 individuals. It does not have to be conducted just during the day. It may be something that occurs on the weekends or in the evenings, because it should occur at times that are natural to whatever the individual wants to participate in. That might include some volunteering opportunities. It might include some development even of some appropriate work attitudes or career planning to help determine a person's career goals. And it should occur in natural settings where the person has the opportunity to interact with people without disabilities. This is not a center-based type of service. Oh, I forgot to do that real quick. Sorry about that. So there's some of the allowable activities. There are a number of other ones that will be listed in the regulations. They wouldn't all fit on the slide, but this gives you some sort of a flavor of the things that might be included. Go ahead and just click all those in now this time. Community coaching is another new service. And this is a one-to-one service, so one individual to one staff person, and it's really designed to help build a specific skill or set of skills that might be preventing somebody from participating in community engagement. So perhaps somebody has, some fear or issues around participating in a volunteer activity that community engagement group, is doing with that person's friends. But the person really wants to be able to do that, but maybe they're just really worried about that, or that triggers some issues for them. And this one-to-one service might enable that person to, work on that those particular issues with their community coach. Maybe it might be something that would help someone to utilize public transportation, and that's probably best taught one-on-one. There's a variety of different things that could be done with this to help the person to utilize community activities, events, and help them to be able to participate in broader range of activities in the community. This is workplace assistance. This is obviously a work-related service, and this is typically for somebody who has completed job development and job placement training, most often with a job coach. So they've done the majority of the supported employment work, but this person may require the ongoing presence of a staff person to help them to maintain their employment. Sometimes the social behavioral types of issues are more the reason for somebody to end up losing a job than the actual job skills themselves. And so this service is designed to help them maintain that employment. It's a one-to-one service, and can include the inclusion of some assistance with personal care skills, but that should not be the only reason that this is being used. It really does also have to support the person in non-work skills that are necessary to keep employment, such as social skills, behavioral skills, those sorts of things. Residential options, here's the listing and the various waivers that they're present in. Again, the red are the new services. You'll see some services here that the names may sound a little unfamiliar, and they are in black, and you may be wondering, such as supported living or group home residential. Those aren't in the existing ID waiver, but really they are. They're lumped under the category of congregate residential support, and now we have broken those into these three different types of services. So now it's group home, sponsored res, and supported living are all the former congregate services. In terms of our new services, however, in the building independence waiver, we have a new service called independent living support. So this is for adults, because that waiver only includes adults. And this is one that enables individuals to live in their own home, their own apartment, with or without roommates, and to be safely supported in that particular setting. It's not for somebody who's living in a licensed setting, and people do need to have a backup plan for when that service can't be provided as regularly scheduled, and it will include both skill building and just sort of routine support. Shared living is another new service that's available in all three of the waivers, and that's actually Medicaid payment for the portion of room and board that can be attributed to somebody who is living with the person with disability. So this is the one time when CMS will actually pay for room and board, but not for the individual with disabilities, but for their live-in companion. So this person would live with the person. The living companion lives with the individual who must be the the lease or mortgage holder for that particular setting. So it's different from sponsored, where an individual goes to live with a sponsor or family in their home. In this situation, it's the individual's home, and the living companion goes and lives with them. It might be a family member, however, it can't be a parent or a spouse. And the main responsibilities of this living companion is just to really be there as a support to that person, to ensure that the person is safe, provide them with companionship, basically, help that person to get out in the community and be a part of community life. Crisis services, we had in waivers previously 2 different designations of crisis services, and now we are sort of breaking out into 3 different types of crisis services. So the existing crisis stabilization, crisis supervision services are being replaced by these new ones. So we have community-based crisis support, and those are really for people who are at risk for homelessness, jail, hospitalization, danger to themselves or others, and these would be provided in the person's home or in another community setting. The staff would work with them and their support provider or their family to help avert any future psychiatric or hospital type of place. These services can be provided limited to really 6 months per year, to be authorized in 30-day increments. Center-based crisis support, these would be services that, such as those that are provided in our current REACH program, and this would be an individual being in a crisis therapeutic home where they are assessed, closely monitored, and have these different types of supports provided to them. Their medications are managed. They have a behavioral assessment. Their family members or other caregivers can receive training through that provider, and basically the person is supervised to ensure his or her safety. Again, this is limited to an authorization of 6 months per year in 30-day increments. And then the final crisis support service is just called crisis support services. And this is one that is broken into sort of 3 categories: preventing crises, intervening in crises, and then stabilizing the individual. So there's a lot of guidance around those 3 different elements. But we're really trying to make sure that people avoid crisis as much as possible, those who have had those experiences in the past, and that those who are in the midst of a crisis are stabilized and their current living situation is strengthened. We have 1 new medical slash behavioral support option, although I do also want to mention that although therapeutic consultation is not a new service, we are breaking that out into different reimbursement groups. So therapists like OTs, PTs, speech and language pathologists, BCBAs, licensed behavior analysts, and rehab engineers are all in 1 reimbursement category. Psychologists and psychiatrists are in another one, and then other professionals such as positive behavior support facilitators and LPCs are in a 3rd reimbursement category. And we've also written the amendment so that some actual direct behavior intervention will be reimbursable under behavior consultation. So our new service is private duty nursing, and that's distinct from skilled nursing, in that skilled nursing is really designed to be more of an in and out type of service, whereas private duty is more of a continuous care, so for a whole shift, let's say, of care for an individual who requires nursing services as prescribed by a physician. And then there are just some other services. We're just calling those additional options. some of these services are yet to be available. So benefits planning, community guide, and non-medical transportation were all included in our proposals, but will not be available until July of next year. So more to come on those services. The one service that is new that will be part of this go-round, hopefully, is electronic home-based services. I mentioned before. It's another sort of technology type of service. So this is based on the smart home technology, and it may be something as involved as actual monitoring devices or cameras in an individual's own home or apartment that are then wired to a center that has continuous monitoring of that person to just ensure their safety, and then can contact a staff member at an agency to go and check on that person if he or she should have an emergency. Or it could be something much less involved, such as some sort of a handheld device that enables contact between the individual and his or her family member to, again, ensure his or her safety. It's really designed for people who are living on their own, not somebody who's going to be in a group home or other residential setting where there's continuous staff involvement. Okay, and I included here a slide that has the link to our reimbursement rate on our website. If you want to know exactly what the proposed reimbursement rate was for the various services, that should be there. And transfers between waivers. So I mentioned this last week, but also just to catch people up, we are requesting reserve slots to support emergencies. So people who may be on the waiting list or even just sort of newly identified, there should be slots to support them, and also the ability to move between waivers. So there will be at least 40 reserve slots to support movement, and these will be managed by DBHDS, not part of the routine slot assignment process. And the reserve slots will be for people who experience some sort of a change in their assessed needs that requires the services of a different waiver other than the one that they're in, or if they choose to live in a more independent setting, such as an apartment that somebody may want to move from the Family Individual Supports waiver, let's say, to the Building Independence waiver, and be a little bit more independent. Oh, little time thing. All right, and then our final slide is just that contact information. We do have the toll-free number up now, so if people have questions, they can call that number, and we are anticipating the interactive website to be available later this month. And as always, the My Life, My Community portion of our website contains information, latest updates, things are posted there. And that's all I have.
Well, Dawn, that's not all I have on this end. We got lots of good questions. We got a lot of good questions. I want to remind everyone that you can enter in a question on the right-hand side of your screen. There is a box to type in questions, and so that's where you can place your questions. Will the current limits for assistive technology of $5,000 and environmental modification of $5,000 remain the same?
Yes.
Can a parent charge their children caregiver rent and then the rent be reimbursed?
Charge their, I'm not sure I understand the question.
Can a parent charge their child caregiver rent and the rent be reimbursed? And I believe that this is intended to be a question for the new community living waiver. Or yeah.
For shared living, you mean?
Yeah.
No, shared living cannot be provided by an individual's parent or spouse. If I'm understanding the question correct. So there would be no parental involvement there.
Right. Do you have to be enrolled in a day program to access the new employment and day options?
You would access them through a DBHDS licensed day provider. You don't have to go to a center, let's say, and participate in group services in order to access community engagement or community coaching. But those two services are performed through an agency that has a non-center-based day support license.
Kind of going to our first webinar a little bit, but we do have a few questions on this, so I want to just quickly, Dawn, there's people asking about priority 1 and priority 2, that they're hearing that lingo, and they're wondering, since they haven't heard those terms yet today, how do they fit in today's presentation?
Well, the prioritization is related to the waiting list. So really what I was talking about today was more people who are already in the waiver or will be receiving a waiver slot. So last week's presentation dealt a little bit more with, before you get on the waiver, you are on the waiting list, and this one is more people who are enrolled in the waivers. So prioritization really has nothing to do with individuals once they're enrolled in one of the 3 waivers. The prioritization is a means of helping us to manage the slot assignment process.
Thank you. Will attendant hours be impacted by the new tier and levels?
Attendant hours?
Yes.
No, not by the tiers and level. Attendant hours may be impacted more by the DOL rule, but that's a topic for another day.
In regards to the services, and I'll just clarify the question from what it might have meant. Would the number of hours an individual had assigned to them to use in a given week potentially be changed from what they have today by the new service, by the new tiers and levels?
The number of hours for what service? Was there a particular service there?
Right. A person with a disability has 20 hours a week of attendant care today under the ID waiver or DD waiver. Will that number of hours they have authorized for them to use be impacted by the new tier or levels?
Yep, I see. No, actually, personal assistance is not a service that is reimbursed according to tier at all. So that it would have no effect on them at all. That service will continue to be authorized on an hourly basis and reimbursed, per hour based on the reimbursement structure that DMAS has set up for that service. So there's no effect.
Does community engagement replace the non-center-based day support services?
Well, it's a different variation, I would say, on that. So in the past, day support itself sometimes included some time in the community, sometimes included some time in a center. What we're doing now is this is a particular service that has even expanded allowable activities from what was permitted previously under day support, and it is something that must be totally in the community and has a prescribed staff to individual ratio. So while it may be seen as sort of a successor to the day support that was the community-based part of our old day support, it is also its own distinct service, I would say.
What will the process be, and you've covered this a little bit, but what would the process be to change someone from the community living to the DD waiver or vice versa, and when do you think that process would actually be able to begin?
Well, as I mentioned, there will definitely be some criteria for that because we have such a small number of reserved slots this year. It will need to be something where the person has a real change in their assessed needs, or they've got the opportunity to live in a more independent setting, those sorts of things that I mentioned. It will be something that we will have to examine on a case-by-case basis at DBHDS. It would be available once the amended waivers are approved by CMS.
Does electronic monitoring require a local human rights committee review and approval?
I probably is going to depend, I would think, on what exactly is being requested. So certainly electronic home-based support, some of those things, such as handheld devices, the elements that might be like a hook to the door to remind somebody that they have the stove on, those sorts of things obviously won't. If somebody needs the cameras or something that is slightly more intrusive, that may. I can't say for sure about any particular thing because I think, again, it's going to depend on individual basis.
Okay. This is an interesting question. In a nutshell, can you tell us what the primary differences are between the DD and ID waiver, or what will, the new waivers?
So what are the differences between the community living and the family individual supports waivers?
And what are the primary differences?
Well, in terms of services, the community living waiver includes those sort of congregate residential successor services, if you will. So it includes group homes, sponsored residential, and, well, supported living is in the family individual support. I'm sorry. So it includes those two, the group homes and the sponsored residential services. And the family individual supports waiver includes the individual and family caregiver training service. That's the only waiver that particular service is available in. I think we can kind of look in the future to the family individual supports waiver as meeting probably most people's needs with the variety of supports that are available in that service. Hopefully over time, that would be one that people opt for more and more rather than individuals going to group homes, let's say, as their residential option.
A couple of employment questions, Dawn. How will the new waivers impact an individual's ability to work? For example, how does the partnership with the current Department of Aging and Rehabilitative Services and individual employment coaches work?
I don't see that there's really any impact on the relationship with DARS. Individuals still must go through DARS first to determine if DARS funded services are available. Same sort of thing if an individual is a youth in school, and they would still need to check out IDEA funding before waiver funding for employment services. But once those things have been examined or exhausted, then waiver services can be provided in an employment arena.
Continuing on with employment, can you elaborate on what kinds of specific services workplace assistance can provide to an individual and differentiate these from ongoing job coaching activities?
So sometimes people really just need somebody to be there with them to ensure optimal behavior and interaction with customers, let's say. They may require some assistance with personal care types of things, or appropriate use of lunch facilities, those sorts of things. As I mentioned, that shouldn't be the only reason, because somebody could receive personal assistance on the job for those services if that's all they require. But if they require something to enable them to maintain their employment or ensure their health and safety, they've got some sort of a medically related type of issue that just requires eyes on or to ensure their health, those might be areas where the workplace assistant would be valuable. Perhaps their particular job requires some time management skill, and they require assistance from a workplace assistant to do that well. So I think there's going to be a variety of different things. I remember years ago working with an individual in supported employment where he was trained to bag groceries. And he did a great job at that, but he just had a real penchant for touching every baby that came through the aisle, and that was very disconcerting to some parents. And so perhaps having an ongoing assistant with him to kind of remind him not to do that would have enabled him to maintain his employment much longer than he did.
If, in sticking with this workplace assistance, just for one more question, are there limits in terms of providing job coaching through that workplace assistance?
Are there limited terms?
Are there any limits in terms of what job coaching can be provided?
Well, the job coaching should be provided before workplace assistance. So the person should have already been hooked up with a job and have their job training completed. So this is available once the job coach has sort of faded from the job site. And then at that point, then the workplace assistant would be there to provide those ongoing supports and work in tandem with the job coach, who will continue to check back with the employer and with the individual and make sure that things are going well on the job site. But typically job coaches do not stay with an individual throughout the duration of their employment unless it's group supported employment, and that's not the model that we're using here for workplace assistance. This is for one-on-one job coaching and individual competitive employment.
Thank you. On sponsored residential, a couple of questions. If an adult is now in sponsored residential services with the parent as a sponsor, will these waiver changes change that situation?
No, it should not.
And why is sponsored residential not available in the individual and family support waiver?
That was just a determination. We needed to separate services out according to waivers, sort of related to cost. We in order to enable more people to access waivers, we've got 3 different waivers that have different average costs, and so that sponsored and group home are some of our highest cost services. So we put those in our highest cost waiver, so to speak. We did need to just make some distinctions. I know there have been a lot of people that would like to see, all the services and all the waivers, but then if that were true, then what's the point of having 3 different waivers?
Okay. Will ABA, Applied Behavioral Analysis, be a service for any of the waivers?
ABA is not a service in the waiver. Those who provide applied behavior analysis can be a therapeutic consultant for behavior consultation. They may be able to provide, as I said, under behavior consultation now, some direct support to individuals, not just the consultation piece.
Right. Of the new services that you discussed today, will any of them be consumer directed, or will all services only be agency directed?
The new services are all agency directed. We retain in the community living waiver and the family individual supports waiver the 3 existing consumer directed services of personal assistance, companion, and respite.
If an individual is currently in the receiving services through the ID waiver, which will become the community living waiver, and they have no intention of using 24-hour supports, I don't know if they mean group home or sponsored residential, will they stay with the community living waiver, or will they be, it doesn't say, will they be moved to the individual and family support waiver, and will they have a choice?
We will not be moving anybody other than those few children. It's really just a handful of children who are in the current day support waiver who will need to move to the family individual supports waiver, as I mentioned before. Those are the only ones that we will be moving, but they'll actually be receiving a richer package of supports or access to a richer package than what they have currently. But if somebody is in the community living waiver, they will, regardless of their service composition, they will not be automatically moved to a different waiver. Now, it may be that over time, individuals would opt to move to a different waiver that better meets their needs in order, to be more independent, for example. That's always a possibility, and we would encourage that. We would encourage people who want to leave the group home and live in their own apartments. They can do that through the building independence waiver, for example. But we will not be automatically moving anyone.
Are the new crisis stabilization services the same service provided under REACH? And if not, what would that new service look like?
The one center-based crisis is very much the REACH model, although it doesn't have to be offered in one of our existing REACH settings. The provider would just need to meet all of various requirements for that service. But that center-based crisis service is that crisis therapeutic home type of model.
Will the state legislature or state general assembly need to earmark a specific amount for each slot on the 3 newly designed waivers, as they do now for the DD and ID waiver, or will it depend on tiers? And if it's not dependent on tiers, how is this funded?
My understanding presently is that the slots are budgeted according to the average cost for the particular waiver. Going forward, I don't know if that would change any, but that's my understanding how it will continue to be, at least for some time.
Will therapeutic consultation or therapeutic recreation be covered as it is now?
Therapeutic recreation as a service under therapeutic consultation is still available.
A difference question. How are the community engagement and community coaching services different from the companion services?
Community engagement and community coaching both have a skill building component requirement. So the objective for those services is for individuals not only to be out in the community, participating in the community, but to actually be gaining skills in those types of arenas. So they have various allowable activities, as were on the slide, that include gaining skills in those areas. Companion services, not at all a skill building service. It's really just designed to assist the person with accessing the community, and the focus is not on any sort of skill development.
So skill development versus supervision.
Correct, and assistance, yes.
Okay. At what point in the process will people get appeal rights at for SIS, for the development of a plan, for a choice to move between waivers. Can you tell us a little bit about what points people will get appeal rights?
Well, generally people are given appeal rights when they apply for the waivers and are placed on the waiting list. That's the first juncture. If an individual wants to receive a particular service and through the service authorization process that is denied, or they receive less than the required or the requested amount of service, then they receive appeal rights. If their waiver should be terminated for any reason, they receive appeal rights at that juncture as well. Those are the main ones that I'm aware of.
For the shared living service, who and how does the live-in paid individual get chosen? So how do they get chosen? And how do they get reimbursed? And is this a CD type of service?
They are chosen, they should be chosen by the individual, and if the person has, family involved, I'm sure that the family would also be involved in that choice. They may be sort of linked to that individual or suggested by a support coordinator or by the administrative entity. I didn't really get into a lot of details about that service, but there is a requirement for there to be some sort of administrative entity to pass the funds through. So that entity may also assist somebody. I imagine, as with CD services, currently most individuals will sort of come with an idea of who they would like to be their live-in companion. They may really want their cousin or their brother or that sort of thing. And those that don't, we have those various options. The way that service will work is that the administrative entity bills DMAS, and they then transfer the money, pay the money for the room and board to the individual. And that sounds a little odd, but that is a CMS requirement, that the money has to go to the individual for the live-in companion's expenses. And then the individual is the one who would then make sure that the rent is paid and whatnot.
Okay. With that being a new service, Dawn, I do think there will be a lot of confusion about how it can be used and how it will be organized. For that and many of the other services that are going to be new, but that's a good example based on the description you just gave. How are people with disabilities, families, and providers learning the intricacies of how to bring that service online?
Well, I know that we have, DBHDS has done a number of trainings in the past couple months. We have done outreach to support coordinators, case managers, providers about the various services. We've also done 5 regionally based trainings for family members and have 5 more across the state in the works presently. So all of those are ways. We're going to be making information as it becomes available to support coordinators, case managers, and we're hoping that that those are our real mouthpieces to individuals that they support. So as they have meetings, face-to-face meetings, and annual meetings with individuals and their family members, that they are talking about some of these new services and giving them options. So they are required to offer them choice of all the various options that are available in a waiver for which that person is eligible. So I think it's a combination of all of those different factors.
If a school system provides transition services, and I'm assuming we're talking about school to adult life transition services, can the school system request reimbursement for those services?
If the school provides transition services,
yes.
Not that I'm aware of. That's not really anything that's covered under the waivers.
Thank you. Are there providers for the new services, and how will people know who's available to provide these new services?
Yes, we have a number of providers already approaching our Office of Licensing to ensure that they have the appropriate license for the new services, or requesting to do a service modification if they don't have that license. I think that we will, once we get more information about that, we'll be sharing those with case managers so that they're able to then help link individuals to providers of the various services as they do now.
I'm going to walk us back to an elderly or disabled with consumer direction EDCD question. And the question is, what are we, from a family, what are we supposed to do with our young adult if in the waiver redesign it's not going to cover adult daycare services? I thought this was the whole point of the waiver, to help you with expenses once the individual ages out of public support.
I'm not sure I'm understanding the question, because we were never redesigning the elderly and disabled waiver. That was not part of this particular redesign. This was related to the 3 waivers specifically for people with developmental disabilities. And within each of those 3 waivers, there are a number of different day types of support. Somebody could receive group day services if they are not able or interested in receiving services in the community. So that would be sort of the nearest service to adult daycare. But we encourage people as much as possible to participate in the community-based day services that will be newly available, such as community engagement and community coaching. So those are the comparable day type of services that are available in these 3 waivers.
So I think, Don, the issue is if they're receiving adult day health care through the EDCD waiver, or they're private paying, until they are actually enrolled in the new one of the redesigned waivers, these services aren't available to them now or when the redesign begins.
That would be correct.
Yeah, I do think that might be part of the issue, is that what we're talking about with the redesign, once an individual receives waiver slot, the new one of the 3 new DD waiver slots, then these services would be available to them. But as you said, this is not going to impact people who are remaining on the waiting list or receiving other waiver services through, such as the EDCD waiver.
Correct.
Don, will public partnership remain the fiscal agent for consumer-directed services in the 3 waivers, or 2 of waivers?
To my knowledge, yes.
Okay. Well, Don, we're nearing the end of our time here. I wanted to give you an opportunity to say anything that you wanted to before we close the webinar.
I would just like to thank everybody for participating on the webinar today, and for all of the great questions. And I'm sure that Maureen will forward the additional questions, and we'll try to get the answers out to folks. We're really looking forward to the amendments being approved and getting to the implementation phase of all of this. And I'm sure there will be new challenges associated with that, but I know we're all up for it. So thank you all.
Don, thank you very much for presenting today, and again last week. Last week's webinar was on the impact on waiting list. The recording from that webinar and the recording from today's webinar will be sent to you. A link will be sent to you in an email or in an email that you receive in the next couple of days. We will leave the webinar up for 10 minutes. If you think of questions that you want to add into the block for our Q&A document, please do so. We also, at the bottom of your screen is an email address you can send questions to. later today. Once the end of today, we won't be taking additional questions for the Q&A, but if you do think of something in the next couple of hours, you can send it to vawaivers@independence.org. The Yahoo discussion group mentioned at the beginning of the webinar, the subscription email address is listed here. The webinar, again, was presented by or organized by the Virginia Medicaid Waiver Network, a grant funded through the Virginia Board for People with Disabilities, our state's DD Council. We appreciate their support for these types of activities to be organized. And again, to the Department of Behavioral Health and Developmental Services, particularly Dawn, for her time here today. Thank you very much, Dawn.
Thank you.
I'm going to stop the on-air showing of the webinar at this time and leave it open for approximately 10 minutes to take questions in the question box. And the PowerPoint presentation will also be available to you. We will make sure you get that by email. Thank you very much for joining today. Goodbye. Hi, this is Maureen Hollowell. I'm going to shut down the webinar now. If you haven't had a chance to type in your question, please send your questions to VAWAIVERS, that's VA Waivers, at independence.org. We spell independence with an E, not an I at the front, ENDEPENDENCE.org. Thank you very much for joining today, and we will get the Q&A out to everyone who has registered for the webinar. Thank you. Goodbye.